The facelift is targeted at volume and definition. So a good facelift needs to restore volume in the mid-face to emphasize the reflection of light, which is youthful, and not the collection of shadow, which is aging. And the second thing the facelift needs to do is to restore definition. Definition of the jawline and the triangular shape of the feminine neck. A masculine or an aging lady's neck are parallelogram, whereas a youthful feminine neck is triangular. And if the facelift can do that, volume and definition, it's done its job. In terms of how much a facelift rejuvenates, it really depends upon the analysis. With facelift surgery, we are seeking to recover something, to restore something of the past, of a time when we might be particularly confident or happy. So we take a series of photographs of the aging face. We ask our patients to bring in a series of photographs, and the facelift is designed to emulate the volume and shape of the face and neck from a particular time of confidence in appearance for our particular patient. So it's a very specific thing. It can set back facial aging by 10, sometimes 15 years, depending on the technique, and it has good resilience and longevity in terms of different parts of the face. In my practice, we carry out the facelift procedure under twilight anesthesia. So the patient is completely comfortable, but at the same time animated. I can have patients singing to me whilst I'm operating. And the purpose of the facelift determines the way it's carried out. So some facelifts, the mid facelift, can be done as an extension of a lower eyelid blepharoplasty with a scar underneath the eyelash line and no scar around the ear. And some facelifts require some form of scar around the ear so that we can access all the layers of the face, 5 layers of the face, and all of them contribute to the type of facelift carried out, and the detail of that depends upon what we're trying to achieve. When considering the limits of a facelift, we need to think about what is the limitation? What is it that is going to limit us? The answer to that is what's gone before, the medical history of the patient, and so on. A history of fillers in the face can be a little bit counterproductive. And sometimes during the facelift, we have to change our technique or what we're aiming for because of what we encounter in the face. But our aims from that facelift in terms of what we're seeking to achieve are volume and definition. And the limits of the facelift should really be around those two things, volume and definition. And of course, what goes without saying, being safe and secure in outcome. I like to measure the outcomes and successes of a facelift in 3 different ways: function, appearance, and emotion. I want my patients to be happy with the outcomes of their surgeries. So we measure these things very straightforwardly. We want to make sure that our facelift doesn't damage any of the structures of the face, so that the function of the face in terms of communication and balance and symmetry and facial expression are all maintained. The second thing is appearance, and we can clearly measure change of appearance, both on photographs in a linear way and with 3D surface scanning. And the final thing, the emotional aspect, has been very clearly and very precisely investigated independently, academically, and published in the plastic surgical literature with questionnaires of outcome measures, which my patients will fill in before and in a series of appointments after the surgery, so that we can very clearly have an outcome measure that tells us that our patients are happy, preserves their function, and rejuvenates their appearance. So the facelift is a basic unit of delivery of rejuvenation in the face. But of course, we can add many other things to achieve facial balance. In the upper third of the face, we can add a brow lift, and that can be done in various different ways. And around the eyelids, we can provide definition to the upper eyelid, the 4 lines of definition: eyelash line, pretarsal crease, the orbit, and the hairline eyebrow. And we can also add, sometimes if necessary, very specific and detailed procedures just under the chin in the submentum. So there are units of the face which are adjacent to what we call aesthetic units, and we want to balance off all those aesthetic units in the face with other procedures that might be valuable to do that facial liposuction and other things. In terms of what patients can do to facilitate and increase and benefit the results of their facelift surgery, we have a program of prepare and repair. So before our facelifts, we are encouraging a certain form of diet, of dietary boosters, prevention of smoking, making sure health and well-being and weight are appropriate for the facelift. And in the repair phase, after the facelift, similarly, making sure that there's a comfortable environment, a good diet for healing, and a general level of fitness. And then in the longer term, after the immediate post-operative recovery, there are many adjunctive procedures that are used for maintenance, non-surgical things like maintaining good quality skin health, protection against the sun, but also boosting the biology of the skin with topical things like chemical peels, or very occasionally here and there, some volume boost with fillers or some maintenance with Botox. These things do not replace surgery. They improve and maintain the result of surgery. They come from a different box, and they're all used together for the best outcome.